old male coming in with no past medical history, with left upper quadrant pain. We didn't see anything in the left upper quadrant.
So
for those of you who are not,
in any guesses or suggestions?
Yeah, just so you guys know, for the new Philips, they have a directional power Doppler. So you still get directional information, but you know it's power Doppler because there's no numbers on the scale. So they are trying power Doppler here, but we're not seeing any flow on Doppler.
So we're wondering, maybe is it tumefactive sludge? Doesn't seem to have flow to be a mass.
So our sonographers are pretty good about trying to change the positions of our patients. So it stays in the fundus in multiple patient positions.
In one image, it almost looked like the whole fundus was thickened. But,
Yeah, I always find the fundus sometimes difficult because you're getting on kind of the edge. You're not hitting the fundus perpendicular to the direction of the sound waves, and you're often up against the bowel. So it can be pretty tough. So this came in overnight, and our residents who have been taught by some amazing people at our institution, such as Dr. Pedrosa and Dr. Khatri, who have been hammering into them that MRI is the end-all be-all of radiology. Our residents all say, must get MRI. So the patient was discharged and an MRI was done.
and Rajesh is asking if there was a stalk because he's wondering if it's a polyp.
No stalk was seen, but it does kind of look like it's hanging off the fundus there. That's a really good observation. So a month later, the patient comes back for the MRI. If this had come back during the day in our current workflow, this is something we would have probably added on contrast enhanced ultrasound to. We're finding it really, really great for these masses where is it tumefactive sludge? Is it a real mass? Because contrast enhanced ultrasound, not only do you have usually a really good acoustic window for the gallbladder, but your signal to noise with microbubbles is amazing. So it's really an on-off whether or not there's blood flow. But the patient comes back for a MRI. And let me see if I can pull this up easier here. Can you see my 3 MRI images?
Yes.
So we have all T1, non-con, arterial, and subtraction. So anyone want to give us discussion points here?
So it looks T1 bright, and on the subtraction, it looks like there is enhancement in it.
Yeah, so both fantastic points. So there is some intrinsic T1 hyperintensity. And so if you were in a first-year radiology lecture where they're hammered in, what are the classic intrinsic T1 hyperintense tissues of the body, one at usually at the top of the resident's list, but usually the bottom of reality is what?
Melanin. Is that
melanin.
What you're for?
Yes.
I'm thinking like usually we think blood protein, but yeah, melanin can do that.
Right. So it's usually like some mineralized fluid with calcium or metals in it, or proteinaceous fluid and so forth. But this happens to be melanin. So if on this ultrasound we actually see multiple nodules here in the retroperitoneum. I think there was one down here, yeah. And the subcutaneous tissues here and here. And here, and then of course in the adrenal gland. So this was unsuspected. This patient had stage 4 melanoma after a biopsy, and there's multiple pulmonary nodules. Fortunately, this guy has one of those mutations where he's responded very, very well to immunotherapy, and all of this is melted away in the interim. But I just thought it was a interesting case where the presenting finding was a mass in the gallbladder, and just another interesting.
Yeah, cool. Why do you think the ultrasound did not show any flow? Do you think it was just even like the power Doppler?
We actually have had some debates about that in our department. We don't know if it is based on our current ultrasound scanners. We've found that the current model is not as sensitive. The complete digital models of ultrasound scanners don't seem to be as sensitive for slow flow as the old analog systems. And I think that is a persistent issue. I don't have any experience with B-flow, but in these cases, these are the, with slow flow in the portal vein, or differentiating whether there's thrombus or not, or in a case like this is where I've been going to contrast enhanced ultrasound.
Cool.
Speaking of which, my next case.
I have one more question.
Oh yeah.
And I don't know if this is true. I'm wondering if anybody in the audience knows this to be true, but I read somewhere that the ones that have melanin, that are T1 bright, like melanoma mets, these are the melanocytic ones, and those have like a better prognosis than the ones that don't have melanin in them because they've de-differentiated. Does anyone know if that's true? Maybe I just hypothesized it. Okay, I'll drop that.